Our specialty is in looking after conditions of the gastrointestinal tract and liver, which is our primary specialty.
So the predominant presentation would be people with, in simplistic terms, vomiting, diarrhea, abdominal pain, bloating, abdominal discomfort, weight loss, anemia. So these are the sort of key areas that we would actually be sort of referred.
And our job then, once patients are referred by the general practitioner, is to undergo a number of investigations on patients to discover what the problem is, and then to treat them based on the findings.
I see the inflammatory bowel disease patients, the patients who've got ulcerative colitis and Crohn's disease. So those patients, either they're newly diagnosed, or they're diagnosed in the endoscopy department, or they're existing patients that have the condition for many years and they're in and out of hospital on a regular basis. For the new patients that are diagnosed, they generally come into the endoscopy department and have a colonoscopy. When they're diagnosed, then I meet the patients and I give them all the information on their diagnosis of Crohn's or ulcerative colitis. I suppose purely my role is kind of educational, really, to kind of give them the information that they need. As I say, whether it's a new diagnosis of Crohn's or ulcerative colitis, or whether it's information regarding new medications and new treatments that they'll be starting on.
When patients come up to our day case endoscopy unit, we can get a number of investigations done just on the one day. In addition, as day cases, we can also do a variety of blood tests. We can do various scans and x-rays. So we can give a fairly comprehensive series of investigations just on the one day.
So it often isn't just the test, it's actually just to try and instigate a management plan for the patient. So that's one of the advantages to the bonds is the rapid access to these investigations, but also the facility to actually hopefully have consults from other team members if it's thought appropriate, because it's not always a clean presentation as such. There's often multiple problems sort of coexisting. So
I think it's kind of the care that patients get, really. They know that when they step inside the door of the hospital that they are going to be looked after. In
addition to us evaluating the patient, we can also get the patient seen that day by a surgeon, and the various other scans and that kind of stuff can also be organised, which is very good for the patient, because they want to know what the problem is, what the extent of the problem is quickly.
You'll meet patients that'll come in and they'll recognise a nurse that looked after them in the past, and the nurses will actually recognise patients that they've looked after, so it's very personal, I think, here, definitely.
What gives us most satisfaction really is seeing patients through that journey, and it's a lifelong thing.